Hi everyone, welcome back to my channel. So I just wanted to add some additional commentary to another video that I posted on the UHC gunman. I wanted to talk about, in that video I sort of addressed, him and his issues, but, one of the things I stated in that video that this is far beyond the healthcare system in the United States. Our healthcare system is not great. But even within the healthcare system, even if you're somebody that is fully insured, you have good health insurance, health in general in the United States is poor. We know that we have a lot of unhealthy people. There's a lot of people who are very sick. But there is also this sort of, how can I say it, almost this contradiction of we are one of the most advanced nations medically. We have some of the best research universities, medical centers in the world. We have some of the highest requirements to become a doctor, higher than Mexico. For example, if a doctor from Mexico comes to the United States, they have to go through medical training here. They have to go to medical school here. They cannot, their medical license does not transfer over. I think only a few countries can do that. I think in Canada, you can transfer over to the US, but there's very few countries because our standards are so much higher here for doctors than anywhere else. Which makes it ironic given the fact that we have so many sick people. We are, very low on the list of, medical care and health, for our citizens. Yet we have some of the most advanced research and, medical training. And I've always thought that that was very odd, given the fact that, that our healthcare or that people are so sick in this country. And that was sort of one of the other things I wanted to touch on in that video, but it didn't pertain to the shooter himself. And this is more of a, something that I've observed being sick for so many years, and possibly something that he was starting to catch on to, and that many of us here in the United States that have chronic conditions are learning. It's that even though with all of the advancement, all the medical training, the up-to-date research and all of that, doctors still seem to not know or not be able to help, probably because of insurance and the way that our medical care system is structured. I have noticed that doctors will toss me around or refer me to someone else because they don't want to run certain tests, or they don't want to fight with insurance in order to get me certain medication that I need, and medication that's very expensive. You will notice the more expensive a medication is or a procedure is, the harder it is to get, even if you do need it. But what I have noticed is that doctors even have very little knowledge of things that they should know about. And if any of you watched the ureaplasma videos that I posted recently, they were very, very popular because it's something that for whatever reason is not talked about, but it's also not really well known among doctors, which is wild to me because it is very common. A high percentage of the population has it. Doctors cannot decide whether it's an STD or whether it's a commensal bacteria that is naturally found in your body and your microbiome. But going to a doctor, a gynecologist that should know about all of these types of bacteria and women's health issues, and being told, I have no idea what that is, when I was told by an urgent care doctor, you need to see a regular gynecologist. You need to talk to them about this. We can't guide you through the treatment to this. We can only prescribe you the medication. And, and going to my gynecologist under my insurance, I have Medicare, and having her tell me, I have no idea what this is, is just crazy to me, right? Being one of the most advanced nations in the world when it comes to medical research and you know even technological advancements in medicine. And I ended up having to find through Reddit, through the internet, a doctor, a gynecologist that was knowledgeable about ureaplasma. And she was a bit far away from me, so I had to get transportation to go see her. And I had to pay out of pocket to see her. And again, that's, even those of us that have insurance, I have Medicare, I have Medicare and Medicaid, so I should be fully covered for most things. Even then, insurance, a lot of these doctors won't accept that kind of insurance because they don't pay them. They don't reimburse them properly. And so I ended up having to pay out of pocket. Fortunately, I have some savings. I did mention in my other video that since being on Medicare, I have been able to be financially stable because I'm not emptying out my bank account every few years trying to deal with my health issues. It is, like I said, even if you have insurance, to have to still pay out of pocket. I had another doctor that didn't take any kind of insurance, and I paid her for many years. This is an issue, and it's going to be a growing problem over the next several years as people deal with issues and chronic conditions like long COVID. It's wild to me that, again, this is one of the most advanced nations in the world when it comes to medicine, yet we're ignoring certain conditions. For example, MECFS, long COVID. There's evidence that both are real and that they're actual conditions that originate from something, yet you'll still have doctors that will say, oh, no, it's not real. There is one doctor, she's on the East Coast, that is sort of at the forefront of long COVID research. And she has said there is evidence that long COVID is a real thing. She talks about certain things that they found, I guess, in like blood samples and things like that of people with long COVID. Yet you'll still have other doctors coming out saying, no, it's not a thing. And we have heard absolutely nothing, with the exception of maybe the first couple of years of COVID. Now we hear nothing about long COVID. It's been buried, just like everything else, just like, chronic Lyme disease and MECFS and all of these other chronic conditions. And the one thing that I have noticed, and it's not just insurance companies, but also pharmaceutical companies, is that if they can't develop a pill or a drug to treat something, it doesn't exist. So if they can't come up with some kind of simple, profitable drug or injection to treat a condition, then it doesn't exist. And doctors seem to jump on that bandwagon to back up these pharmaceutical companies and say, yeah, it's not a real thing. Long COVID is not a real thing. Chronic or post-Lyme syndrome is not a real thing. These things are not real because they can't be treated with a simple pharmaceutical. We know that obesity is a huge problem, and up until recently, most of the treatments for obesity were out of pocket, going to Jenny Craig, Weight Watchers, dieting, those types of things required, willpower and commitment and money. Jenny Craig costs money, Weight Watchers costs money, and that's out of pocket. It's not covered by your health insurance, to the best of my knowledge. Then bariatric surgery became a thing, and that was also, sometimes covered by insurance. I think insurance coverage is getting better because I know someone that recently got it through Medicaid. But you also have to go through a lot to qualify for that surgery. You have to go through a psychiatric evaluation. You have to start losing weight prior to the surgery. So you have to diet and lose a certain amount of weight before you get that surgery. So you still have to do several things in order for insurance to cover it. So there are still certain things that you have to do on your own. And whether you're able to do them or not is a different story. Now we have Ozempic, right? And Ozempic has become the hot thing. It is huge here in the United States. Yes, some people are using it just to slim down, more for aesthetic purposes. But for those people that need it, people that are diabetic and that kind of thing, they can get a prescription for it. And it's becoming the new, like the it girl of, pharmaceuticals. And now you have celebrities like Oprah, who used to be, I believe she used to be on the, what was it, the Weight Watchers. She was an investor or on the board of Weight Watchers, something like that. She gave that up because she is now, she's joined a different team. And once you see that a drug has been developed to treat a certain condition, that condition is widely accepted. Obesity is a huge problem. We're now, we're now coming to a place where it's an epidemic, and now we have a simple solution, which is this injection. Yet there are still millions of people that are chronically ill and are still struggling, and there's no research, there's no funding for to look into these conditions, and people are very, very sick. And yes, people do die from chronic illnesses like this, and that is the bigger issue. Insurance itself is a problem. Insurance coverage, for certain things, it is a huge problem. But then you have, the other side of it is that in this very advanced nation where we are doing research and, researching all of these novel treatments for, again, how did we get to Ozempic, right? There was money and research being put into it because it was something that was going to make a lot of money for whoever developed it, for whichever company nailed it first. They're going to be making billions of dollars off of this. And with chronic conditions, I don't think it's as simple as that. We saw that with the AIDS crisis. It was ignored. It was, a lot of people died. It was also a pandemic. A lot of people died until a drug was able to be developed. There were treatments for it, but people had to go cross the border and go to Mexico to get treated for it. And the United States did not get on board until an antiviral drug was developed. And it's like, okay, now we have this pill, and now we can profit off of this. And now we'll accept that this illness is real and it's treatable, and so on and so forth. It is, like I said, even with medical insurance, there is a bigger problem, when it comes to health, particularly in the United States. And, I think with this gunman, I think he sort of, for him, doing this thing that he did was his way of, self-soothing or being able to put his anger somewhere. For a lot of us, we know that it's not just health insurance, it's medicine in general, in the United States that is a problem. Insurance is one big problem, but even if you have full coverage insurance, you're still going to be dealing with, the lack of research and the lack of attention to certain conditions that can't be easily treated with a pill or with a specific type of treatment. And even things that help us, those of us that are chronically ill, for example, in my case, I got a lot of, I got some help with intravenous immune globulin. Let me tell you, you're fighting tooth and nail. Doctors do not want you to even mention that drug in their presence because it's so difficult to get insurance coverage for that. It's such an expensive drug. And, the doctor is the one that has to fight the insurance company, not the patient. And in the United States, doctors are just overwhelmed. They don't get paid enough to do that. They don't have the time. You know, they dedicate, what is it, 15 minutes per patient, and that's what they're getting paid for. And you know, to end up fighting with insurance and getting insurance denials. I've had doctors straight up just not even do it. I had a doctor that, you know, I waited for weeks and I called his office and I was like, hey, aren't you supposed to be submitting this to insurance? And he's like, oh, no, no, I'm referring you to UCLA, and they have more influence. And if they can get you the medication, have them do it. Because doctors just they don't have the time, they don't have the energy. They know that they're going to get denied. So a lot of them are just like, no, I'll just throw the responsibility on someone else. And I've seen that. I've seen doctors that just, they'll block you from getting certain tests done because they just don't want to go through the mess of having to fight with insurance companies for it. And I think that's why a lot of times doctors will come out and say, oh, this isn't real, right? Long COVID isn't real. You know, ME/CFS is not real, because fighting to get a diagnosis or fighting, you know, insurance companies to get some kind of treatment for their patient is just not worth their time or their energy. And I mean, it's just a whole thing. So insurance is only part of the problem. Research, you know, getting doctors to actually acknowledge that there are certain conditions that are just not easily treatable with a pill or with an injection is the other part of it. You know, when you profit off of people's illness and suffering, you know, or I guess this is the way that another way to see it. Doctors and insurance companies will only acknowledge that you're sick if they can profit off of your illness and your suffering. They'll only tell you that what you're experiencing is real if they can make money off of it. And if they can't, they'll just say, it's not real. You're not really sick. You're just crazy. Get out of here. And illness, health, you know, our bodies are much more complex. They are not that simple, you know, to just be able to give you, you know, a little pill and say, okay, everything's fixed. And in this country, you know, that's what's most profitable. Is a medication is the most profitable. It's the easiest way to turn a profit. And if these companies can't do that, you know, they have a lot of influence on doctors and on what they can do for a patient. And they keep a lot of us sick. I mean, it's more profitable to keep us sick, you know, for us to keep consuming, you know, a few small medications here and there just to help ease our symptoms, as opposed to actually relieving them by getting to the root of the problem, or by investing in research that gets to the root of the problem so that we can solve that, and so that people can actually, you know, have their health restored and function. So I wanted to add that in because, you know, the discussion right now online is insurance companies and insurance company denials and things like that. Yes, that is a huge part of the problem. But even when you're fully insured, like me, I have, you know, pretty decent insurance now. I've still had to find doctors outside of my insurance. I've still had to pay out of pocket. And there still is no easy solution. I still continue to get worse because there hasn't been any research, or very little research, put into my health issues. And a lot of the reason why that is because of pharmaceutical companies and insurance, that they can't offer a pill or a pharmaceutical to solve my issue, therefore it doesn't exist. So their influence goes far beyond just insurance coverage for certain conditions. It's actually, in my opinion, it's stopping research. It's hindering research. And, you know, it's keeping people sick because they're focusing on the things that they can profit off of. And unfortunately, some of us have issues that are very complex and require a multifaceted approach, and not a single pharmaceutical that can solve the problem. So I just wanted to add that in there. This was more of a, disjointed kind of video. It was just something off the top of my head because I do think that this is a larger issue. The gunman just, sparked a conversation. He got the conversation going, but in my opinion, there's so much more to this than what most people, in this country can see on the surface. Those of us who are chronically ill, we see all of the things. This is the iceberg on top. Those of us who are chronically ill, we see the iceberg underneath the water. And we know that the problem is much bigger than just insurance companies. So anyways, thank you so much for watching. Please like and subscribe, and I will see you in the next one. Take care.